Greetings. My name is Kweku Asamoah Bonsu, a rehabilitation counseling student of the University of Maryland, Eastern Shore. Today I'm discussing with you my case conceptualization assignment. So before we go into the case, I would like to discuss with you for us to have a clear understanding of what case conceptualization is. So basically, case conceptualization is a foundation of effective counseling. It is a process through which counselors make sense of a client situation, bringing together the client's history, presenting concerns, and theoretical understanding into a meaningful framework. The purpose of case conceptualization is not just to label problems, but also to develop a clear roadmap for treatment that is personalized and theory-driven. A strong case conceptualization allows counselors to understand the root cause of distress, to set realistic goals, and choose intervention that aligns with the client's needs. So basically, case conceptualization is a way that a counselor uses to understand, to break down the client's situation for a better understanding and intervention. So I'll take some time to introduce to you Richard, who is our client today. So Richard is a 48-year-old white male. He is a high school graduate and has worked as an insurance salesperson for the past 3 years. Prior to this period, he worked as a management level for a telecommunication company, but left the job because he found it too stressful. Richard presents with depressed mood and symptoms of anxiety that affects his physical, social, and occupational functioning. He reports experiencing these symptoms for the past 2 years. During counseling, Richard characterized himself as often fatigued, socially withdrawn, and ineffective at work. He also reports frequent worry, restlessness, and tension, especially related to financial strains and job performance. His income has dropped significantly during the last 2 years. Richard feels guilty for having to rely on his wife, Sandy, as a primary income provider. According to Richard, Sandy often expresses disapproval of him non-verbally, such as when she is writing checks for the monthly bills. The couples argued frequently about financial matters. Richard and Sandy has 2 children, Natalia and James, who have completed college within the past 5 years. Richard reports that both children currently earn more than his present income. This situation makes him feel inadequate and fuels both his depression and anxiety. As a result, Richard feels emotionally distant from Natalia and James and sees them as closer to Sandy. Richard's social activities typically involve his wife and work-related. He spends his spare time on his computer and reading. He reports having no friends. During counseling session, Richard seems uncomfortable. His difficulty maintaining eye contact, laughs nervously during the shortest period of silence, and comments on his discomfort with the lack of structure. His anxious behavior and difficulty relaxing appears to be a mirror of his internal stress and self-doubt. Although he seems motivated to change, Richard seems to have difficulty discussing his situation. So this is the case of Richard that we are having a conceptualization on today. So now, based on the full picture of Richard, let me try to break it down into smaller pieces for better understanding. Now, this presentation introduces the case conceptualization of Richard, a 48-year-old male experiencing symptoms of depression and anxiety resulting from work-related stress and relationship strain. Using the person-centered therapy framework developed by Carl Rogers, this conceptualization emphasizes on empathy, unconditional positive regards, and congruence as a core therapeutic principles. The analysis is structured using the 8 P's model, examining Richard's presenting issues such as the predisposing, the precipitating factors, as well as perpetuating and protective influences. The goal is to provide a holistic understanding of his challenges while outlining an intervention plan that promotes self-acceptance, emotional balance, and personal growth. So looking at Richard's presenting problems. Now, Richard presents with chronic depression and generalized anxiety affecting multiple life areas. He reports fatigue, social isolation, and decreased work efficiency, leading to financial strains and relational conflicts with his wife. So these are the presenting challenges that Richard is currently having. Now, Richard's history of job-related stress and his tendency towards self-criticism likely predisposes him to depressive and anxious symptoms. His upbringing and cultural beliefs around achievement may have shaped his rigid self-demand. So looking at Richard's culture, that might be part of the problems that he is following, that he is experiencing currently, because his upbringing and cultural beliefs around achievement tells him that he's supposed to be providing for his family, and currently he is having challenges providing for his family. So thinking about who he ought to be in his current situation, it gives him that depressive and anxious symptoms. The primary triggers for Richard's current distress appears to be his job loss and financial decline, which creates ongoing stress, feelings of inadequacy, and relational conflict. His perception of judgment from his wife and comparison to his children's financial success further intensifies his depressive and anxious symptoms. The stress of losing professional status and autonomy may also reignite old insecurities about competence and worth. So, Richard's avoidance of social connection and reliance on negative self-perceptions continue to maintain his depression and anxiety. The ongoing financial strains further reinforces these maladaptive practices. So he currently gives himself negative thoughts. He feels ashamed of himself. When he sits quietly, he begins to think about his personal worth. He feels he is now incapable, and these thoughts keeps on increasing his depression and anxiety. So, despite his struggles, Richard's motivation for self-improvement, commitment to counseling, and underlying resilience serves as protective factors that can facilitate recovery. Richard's prognosis is optimistic if he actively engaged in therapeutic process, which increase self-compassion and emotional openness. He can rebuild self-worth and relational balance. So despite his struggles, there are positives about him because he is sick or he's motivated to improve himself, and he's also committed to counseling. So now, the plan for Richard is on fostering an authentic therapeutic relationship grounded in empathy and unconditional positive regards. So what this means is during counseling, the counselor has to, understand. He has to have a clear understanding, put himself in the shoes of Richard, putting himself in the shoes of Richard to give him a better understanding of Richard, to be able to help Richard resolve his depressive symptoms. Also, with the unconditional positive regards, what it means is the counselor should be positive towards Richard, even if he presents negativity. The focus of the counselor is not on the negative issues. It's only about the positive sides, what we can do to help Richard come out of his situation. So therapy will help Richard explore his emotions, help him rebuild his identity, and enhance personal meaning. Now, at the point in this counseling process, progress will have to be assessed, and then progress will be assessed through Richard's self-report of mood and anxiety improvement, his social engagement, and his reflection during sessions. These measures will track Richard's emotions and functional growth. The theoretical foundation of Richard's case is personal-centered therapy, developed by Carl Rogers. This approach assumes that all individuals have an innate capacity for personal growth, supported by non-judgmental and empathic environment. So this theory by Carl Rogers encourages that every individual have the willingness to improve, but it depends on the environment that the person finds himself in. So during counseling, if the counselor is able to create that positive environment that encourages self-growth, it is believed that Richard will improve his situation. So the therapist will improve three core conditions, or will provide three core conditions. That's unconditional positive regards, empathetic understanding, and congruence, which I've already explained, to help Richard explore his emotional safety and authenticity. Through this process, he can reconnect with his inner strength and move towards greater self-acceptance and emotional balance. In applying the person-centered framework to Richard's case, the therapist's focus is on creating safe and empathic space where Richard feels genuinely heard and understood, rather than directing change. The therapist facilitates self-exploration, allowing Richard to process his feelings of guilt, inadequacy, and anxiety at his own pace. So during counseling, it's not for the counselor to tell or to make suggestions to what Richard has to do. He is only supposed to support Richard, guide him through the process, so that he will personally come out with what he feels is good for him, and then try to understand his personal situation. Through consistent empathy and unconditional positive regard, Richard begins to rebuild his self-worth and recognize his capacity to grow. The therapist's authenticity and congruence model emotional honesty, encouraging Richard to align his self-perception within or with his true experiences. Ultimately, this supportive and accepting relationship becomes the foundation for healing and personal transformation. So, in conclusion, using a personal-centered framework allows a compassionate and empowering understanding of Richard's experience. These 8P models provide structured yet humanistic approach to guide his emotional healing and growth. Thank you very much for your attention to my presentation. Thank you.